Hello, good evening, and welcome back. Deferred treatments is the topic today. In particular, we're focusing on cancer. Of course, this isn't the only one. The other top one would be coronary heart disease. But there are a load of treatable and needn't be fatal, at least not yet, illnesses, diseases that people can get, and thankfully, like with cancer over the past few decades, it is no longer the swift death sentence that it used to be. It wasn't a thing of, well, you've got this disease and therefore this is what you will die of. You'll be lucky to see Christmas. That isn't the case anymore. No. It's actually treatable, whether that be things like stents for coronary heart disease, or if it's chemo, radiotherapy, that kind of thing for cancer, then people can actually survive it. It's a harrowing process to go through. Of course, there's surgery options as well. If you can remove the tumours, if it's benign instead of malignant, then surgery is still an option if you catch it early enough. And that is the point. That is the point in all this. If you catch it early enough. So our diagnostics have expanded dramatically, which is brilliant news for all of us, of course, which can add several decades onto people's lives. Sure, cancer is more likely in older age, but once you start hitting middle age, then it does become a concern. And so by being able to diagnose you with cancer early on makes it treatable and therefore can add several decades onto your life. However, when a new illness comes along and catches the political zeitgeist, as the COOF has done, this is all put on the back burner, if you're lucky. Otherwise, it's just thrown out of the window. And so, they're now saying it's threatening 100,000 patients in the UK, which isn't quite as many as the people who are reported to have died while also having the COOF. Let's just get that phrasing right. It's not that over 100,000 people have died from the COOF. The reports, if they're honest, aren't suggesting that, or they aren't stating that at least. They're saying died with the COOF. Whether or not those people have actually tested positive for the COOF, whether or not those tests are reliable, is a whole other issue. But nonetheless, at least we can all agree, died with the COOF, not from the COOF. So, from cancer alone, it rivals it from the death toll that we've had. Of course, then you go into flu numbers instead, with even the World Health Organization saying it's very peculiar that we've got 0 flu deaths. And the only accepted narrative is, well, yes, it's because people are being more cautious because of the COOF, as in being more sanitized and wearing masks, that it stops the flu. It's like, what, 100%? I don't think so. If it's 100%, there's something peculiar happening here, if we've been so used to it for so long. So I don't think so. But nonetheless, we can all agree, at this point at least, we can all agree that the response to the COOF has been mismanaged and overblown. I don't think that's a controversial statement, at least not anymore, which is nice that the rest of us have been saying this for not quite a year yet, but it will be soon. How are you going to spend your anniversary of the COOF? Because it has to be alone, of course, I'm sure you remember. But yeah, so we've been saying that for many months, and it is nice to see other folks kind of just slowly starting to realise that that is the case. Unfortunately, for over 100,000 Brits, that's a bit too late. And this is the suggestions, as at the moment, the thought is 50,000 patients are thought to be living with undiagnosed cancer, and then you add on tens of thousands more who have had delayed treatments, either because the NHS is saying, no, we can't treat you, we're busy helping this person with the COOF, or it's people themselves thinking, oh no, COVID is a death sentence and it's worse than cancer. Which, surely at that point, with the propaganda machines, they got to think, I think we've done too much of a good job now. If people are refusing cancer treatment because of fear of the COOF, I think they might have overplayed their hand at least a little bit there. So they go to show pictures, and I'm not trying to downplay an individual's death at all, but let's be real, just an individual like anecdote is not the singular of data, if you will. We are actually looking at bigger trends and evidence in order to lead to conclusions. We're not basing it on emotions. So, they say, scores of MPs today, I think 75, cross party lines as well, warn the Prime Minister that Britain is facing a cancer disaster that could cost tens of thousands of lives. Politicians say as many as 100,000 people could miss out on cancer treatment due to the impact of the coronavirus pandemic, with many dying unnecessarily. And this isn't just taking a few years off. I think it's the latest 8 years, supposedly. Yeah, supposedly. COVID is reducing life expectancy by 8 years. What is the average age of somebody reportedly dying with the coof? Beyond the average life expectancy. So how they get that 8-year figure, I haven't got a clue. But that's it. MPs say that 50,000 patients are thought to be living with undiagnosed cancer as it stands. So say with because of prolonging chemotherapy, radiotherapy, as well as for other treatments as well, just saying, oh, well, you can't come in because this is all a, infected ward. It's all quarantine, so nobody can come in, nobody's allowed. With all sorts of things. In fact, then trying to diagnose cancer through a video call. Yeah, trying to say, oh, I've got a lump, and I got other symptoms, whether it be being faint, for example, something like that. And GP the other side not really being able to give them proper diagnosis, thinking, give you some antibiotics, instead of thinking, no, this is lymphoma, and it's a form of cancer that should really be treated. And then, of course, the patient dies. Let's not pretend that this is entirely new. The NHS is renowned for this. The NHS is supposed to be, at least, cheap and effective, but just not quick. And the issue is that the quickness or the slowness of the NHS mean that it isn't as effective as it could be. And the cost thing is nice, except of course it means that if you've earned more in order to be able to afford better level of care for yourself or your family, you are prohibited from receiving it in the UK. Which I think is taking government's role a bit too far. Death panels are one thing, but then restricting people from accessing life-saving medication is another. Hence, going over to the States to try and save the life of a baby boy. Archie, I believe his name was, a little while back. And of course then a fundraising campaign was created in order to help cover the costs. Yeah, who would have thought that if government doesn't do it, and it's worthwhile, then charity steps in. The community can come together over a common cause that they don't have to be coerced to support. Wow. If only we could do that more often. So, with that in mind, as its slowness, it has been like that for a while, as we know, which means similar to deferred treatments of other things which would be treatable but left too long unchecked, then become terminal or fatal. So we're used to this being a complaint for the NHS, except again, the propaganda of the NHS is so good that they never focus on, here are the facts of the matter, and here's the level of treatment you'll be getting, and here's the success rate, here's the rates of recovery from different diseases or cancer as well, waiting times. They don't focus on any of these. They just push to say, oh, it's good and it's a part of the British identity and it's the envy of the world, without looking into it at all. So if you actually go on the facts of the matter, as I say, cancer survival rate, I don't think we're in the top 10. Waiting times, not either. So any of these actually empirical points of evidence, the NHS simply does not perform. But of course, that is all skipped over because it doesn't fit the narrative. The only one that is used is, but how do you feel about your country's healthcare system? So, oh, well, British people are happy with it. Therefore, the NHS is the best. So, is it? Or is it just that British propaganda about its own health service is the best? Because I think that's what it is. But again, it's the difference between facts and feelings, or emotions and evidence, which is where there's a big discrepancy in the world at the moment, of course. So, from Professor Pat Price, a leading oncologist and founder of the Catch Up with Cancer campaign, warned delays meant patients were coming forward with more advanced cancer than usual. She told the Daily Mail, "We are going to be looking back in years to come at a COVID-caused cancer nightmare." No, it isn't. It is not COVID-caused. It is governmental-caused. And I'm quick to say if something isn't government-funded, it's taxpayer-funded, because the government can't take any credit for that. But what they can take credit for their response to a disease, which is COVID. So let's not say it's COVID-caused. Let's be honest and say it's government-caused, because it is the government reaction which is responsible for this. So, to make a statement a bit more accurate, we're going to be looking back in years to come at a government-caused cancer nightmare that led to as many cancer patients being lost unnecessarily as we lose to coronavirus itself. More than that, no doubt. It doesn't have to be this way. We can save both COVID and cancer patients. It's quite easy to save a COVID patient. But that needs a change in approach. Proper accountability and hard cash at the budget for cancer services. Everybody wants more money. We estimate by the end of the pandemic there could be a backlog of 100,000 untreated cancer patients. And they would have to work at 120% rate at present, or what they're used to, rather, not at present, but what they were used to before, in order to try and catch up over the next year. Growing population as well, they're going to have to stick at 120% and then increase it in a couple of years anyway. So these are people who since last April should have been diagnosed with new or relapsed cancer and to all their treatment, but have not. Some still won't have been diagnosed. Thousands of people are going to die who didn't need to have done. Just thousands instead of up to 100,000? Okay, right. She added, "There are straightforward steps such as replacing old radiotherapy machines or scanners that can help clear the backlog to increase treatment and diagnosis rates." They cut the treatment time down to 15 minutes from 45. Brilliant. The letter was signed by MPs from all parties, including Lib Dem leader Sarah Davey and former Tory Minister Caroline Oakes. They said the spring budget, due to be unveiled by the Chancellor on March 3rd, would be the ideal opportunity for investment in a new cancer recovery plan. Last thing, so I don't overrun, which I will mention when it comes to government-run budgets, is that to me it is very reminiscent of a 5-year plan. It is a centralised planned economy. Surely we can all agree with that. What is the budget saying? It is saying, well, it's it's easier to tax a business than build one, but we're going to spend your money better than you, and we're also going to decide the cost of things and where resources should be channeled to better than you, which is impossible. So the Conservatives coming up with a budget idea. It's just language games again, isn't it? Oh, it's the budget. It's like, is it really? There seems to be a real nice way of saying centrally planned economy. So I lost for words. Wrap up. A record 4.5 million people are currently waiting to start NHS treatment, with 250,000 waiting more than a year. NHS at its finest. Well, that's it for me. So let me know what you guys think down below. Do you think this is new and this is government caused because of their response to COVID? Or, no, we know the NHS is poorly managed, and if it was a private company, it would have gone bankrupt or gone under decades ago for gross mismanagement. But because it is an extension of the state, it is allowed to carry on with its gross inefficiencies and wasting of resources. So they're just going to ask for more money at any opportunity and grab the current item, which is the coof, as reasons for more money. Either way, I'm intrigued to hear what you guys have to say. If you say, Oh, private companies have been able to adapt and bounce back, so why hasn't the NHS? Oh, because the government can't react that quickly. Funny that. Anyway, let me know. Always intrigued to hear what you guys have to say. And as always, until next time, have a good one.